Thank you for watching this video training from www.intouchemr.com, the fast, integrated, and easy EMR. Visit our website for a demo and a free executive briefing on the 5 blunders to avoid with EMR.
Hi everyone, this is Nitin Choda over at intouchemr.com, and in this video, which I think will be valuable for not only the clinician but also the billing staff, I'm going to talk to you about the architecture of a patient statement. Now, as you probably know, the patient is the last payer in the entire revenue cycle management process for any clinic, and in some cases, the patient is the most difficult payer to work with. It's actually been proven, there have been studies done that prove that as far as healthcare bills are concerned, and specifically physical therapy patient statements, that bill and paying off that bill is very low in the list of priorities for a patient. In fact, patients are more likely to pay other bills, such as their cell phone bill, their mortgage, obviously, perhaps their TV and the internet bill, and paying off their bills, paying off their patient responsibility bills from medical providers, from physicians, from physical therapists, is a very low priority for patients. It's it's sad, but it's actually true. In fact, all of this is mentioned in detail. This is one of the 5 biggest blunders associated with any EMR system: the fact that the patient statements are not architected the way they should be. And I'm going to talk to you about how they should be architected. And if you want to learn more about this, I'd urge you to go to intouchemr.com and request our full color executive briefing on the 5 blunders, the 5 blunders to avoid with EMR. We'll just ship that to you, and you'll get a lot of insight from it. But here's the architecture of a patient statement. The ideal patient statement, first of all, should be 1 page. So let me repeat that. The ideal patient statement should be 1 page, should give the patient all the information they need in 1 page. Why 1 page? First of all, easier for the patient to read and understand it. The moment it's 2 pages, people are like, it's too much. So number 1, it should be 1 page. Number 2, it'll save you on the cost of printing and mailing the statement. Because you have 2 pages, you're now paying more for paper, you're paying more for ink, you're probably even going to pay more for postage. Really depends on how it's structured. Even the thickness of the paper can affect postage, because you want to keep the postage as inexpensive as possible. Stick to a first class stamp. So it should be 1 page. The second thing is, the statement should tell the patient what treatment was rendered, should tell the patient what CPT code was billed, should tell the patient what money came back from the insurance company, should tell the patient what the adjustment was, should tell the patient what their responsibility is, in other words, what's left, should tell the patient what they've paid so far, and finally, what their balance is. Something like this makes it very, very easy for patients to understand what is owed by them in the statement. We can actually show you examples of the patient statement that we use over at intouchemr.com, our billing side of the EMR. And the statement is simple, easy to understand, and is 1 page. Once again, the statement should tell the patient what was the treatment that was rendered. The statement should tell the patient what was the CPT code that was billed, which probably isn't going to make sense to them, but they deserve to know what they were billed for, their insurance company was billed for. It should tell them how much money came back from the insurance company, so they know how much money came back. By the way, there needs to be an additional column here that tells a patient how much you billed. So that's that's important. So let's talk about your billing. It should tell the patient how much money came back from the insurance company, how much was adjusted. There's an adjusted amount usually with each claim, and then how much their responsibility is, how much they've already paid, because obviously, if the patient pays a copay, or if the patient pays a certain amount, then their responsibility decreases. All of that information needs to be clearly explained in the patient statement, and your EMR system should be able to generate a simple, easy to understand statement, 1 page statement like this. This is the architecture of a patient statement. The ideal EMR should also simplify every aspect of the billing process. In fact, when you're generating a claim for the patient for the first time for that particular visit, the EMR should let you post the patient payment let's say the patient's paid you by cash, by check, by credit card, you should be able to post the payment to that particular claim, and then all of that stuff gets reflected in the patient statement. So your system should be sophisticated enough to be able to keep track of all of that. That's exactly what we do with the billing component over at intouchemr.com. Don't forget, I do want you to read that executive briefing, which you can get from intouchemr.com. And there's one other important thing I want to mention. Your system should let you generate the patient statement by yourself and mail it out if you want, or better yet, your software should actually allow you, should give you the option of actually having them do it. Having the billing software themselves should be able to print and just mail off the statements for you for a nominal fee, usually the cost of printing and the actual cost of the first class stamp. I mean, a good, depending on the price of postage, depending on what the price of a first class stamp is, the patient statement should cost you anywhere from 70 cents to maybe 80 cents. And now we're in 2013, so that should be the price. And again, depending on the cost of postage, depending on the cost of the actual stamp, your patient statements should be inexpensive and should be easy to mail out, and your billing software should have a mechanism to be able to do that for you, so you don't have to bother with that stuff. Because I don't want you in your clinic to be printing and mailing patient statements if someone else can do it. Your biller, or for that matter your staff, should be focused on more important things like reviewing the claims, perhaps following up with patients, calling patients to make sure that payments have come in, stuff like that. Thank you so much for watching. I hope the architecture of a patient statement and the way it fits in with your overall practice workflow was beneficial for you. Don't forget to go on over to intouchemr.com to request a demo of what we do and the sophisticated patient statements that we have, and more importantly, request the executive briefing on the 5 blunders to avoid with EMR. Thank you so much for watching, and good luck, and let's get paid more, faster, and we can help you achieve that over at intouchemr.com. Thanks.
Thank you for watching this video training from www.intouchemr.com, the fast, integrated, and easy EMR. Visit our website for a demo and a free executive briefing on the 5 blunders to avoid with EMR.